Welcome, everyone, to the Friends of NPACE Podcast. I'm Terry Schmidt, the Executive Director at NPACE, and I am incredibly excited to introduce our guest and the topic today. This is a nurse practitioner she's long impressed me. She's a fantastic teacher, and she just shares this wealth of knowledge with the whole NP community, but she's also very inspiring in the work she's done. She's laid the foundation and the groundwork for so many of us to follow in NP entrepreneurship and billing and coding. So I want to dive into her bio just a minute. Dr. Lynn Rapsilber, she is passionate about cultivating the business brain of the NP, recognizing that this deficit starts in NP education, but she and I were just talking about how we could really cultivate that even in basic nursing education. She started NP Business Consultants. It's an LLC disseminating information regarding reimbursement for NPs, and she's a recognized expert on coding and documentation. She is the co-founder and CEO of the National Nurse Practitioner Entrepreneur Network, NNPEN, elevating the nursing model to transform healthcare delivery systems by creating a financially viable community of NP entrepreneurs, one practice at a time. Dr. Rapsilber received her diploma in nursing in 1981 from St. Mary's School of Nursing, University of Connecticut, a BSN in 1991, and an MSN as an adult NP in 1998. She attained her DNP in nursing leadership from Lynn, I always say this wrong.
Quinnipiac.
Thank you, University. I want to get that right. In 2016, Dr. Rapsilber was honored as the Quinnipiac Transformational Nurse Leader Alumni Award in 2017. She serves as the chair of the Connecticut Coalition of Advanced Practice Nurses, attaining full practice authority for APRNs in 2014. Yay! I know. Our friends in Massachusetts are like, we need some help. She is the former Connecticut State Representative and serves as the Health Policy Chair for the American Association of Nurse Practitioners, and she's an AANP Fellow. She was selected as the 2021 recipient of the Nightingale Award with the American Association of Nurse Practitioners, an NP Advocate Award. She currently owns NP Wellness Care, an LLC providing hepatitis C treatments at residential addiction treatment centers. And she also is serving on the ANA Advisory Committee on Reimbursement. Did I miss anything in that, Lynn?
Oh, we could be here all day if you talked about everything that I've done. So I think there's more important things we can talk about.
Perfect. Well, I appreciate you joining us. Thank you for being here.
Thank you for having me. NPACE has had a soft spot in my heart. I've done a lot of work with your organization, and truly you have a first-class act in putting together quality conferences, and I'm glad to be part of the team.
Thank you. We're thrilled to have you. So I always like to start with every nurse practitioner's story, and I really want to hear yours because I think it bears weight in the things we're going to talk about today. But when and why did you become a nurse practitioner?
Actually, I really need to start back to my RN journey because that's really where this all started. And when I was a new nurse, a newly minted RN, I worked on an oncology floor. And this was back in the early 80s, 1980s. So I'm aging myself right now. But I worked in oncology, and the oncologists were looking for a nurse to come to their office and establish an outpatient chemo program. So at that time, like, the hospital was the pillar of job security. And I said, why would somebody want to leave that? But I also was curious, and I get bored easy. So I'm like, well, this could be an opportunity. I'll go and try it. And what's the worst that can happen? I'll just go back to the hospital. Well, I was there 20 years. So as I was learning about outpatient chemo, I learned about CPT and ICD and costs to deliver the treatment, labor, all that, and then went to the insurance companies to negotiate rates and then provided the chemo. Along my journey, I also was doing higher level nursing functions. And I said, I really need to go back to school and get the credentials to go with this. And that's when I became an NP. So fast forward, I'm in my last semester, getting ready to graduate. And I said to my professor, are we going to learn about CPT and ICD? She goes, what's that? I go, oh gosh, I think we're going to be in trouble here. So I don't even know what my original capstone project was. I just said, can we write an article about the reimbursement process? And she said, sure. And in 3 weeks, we wrote our article. It was published in the Nurse Practitioner Journal, the Blue Journal, in May of 2000. And that really started my entrepreneurial journey to educate any NP who wanted to learn about reimbursement. And believe me, when those early years, I mean, people would fall asleep with my topic because it was so, it didn't really matter back then. And now people are so engaged, and, hundreds of people want to hear about this now because it's so integral into, productivity and reimbursement and their salaries and bonuses and things like that. So the thirst for knowledge is great now.
I agree with that. I just had a flashback. The blue, I mean, that's how we knew there was the red and the blue Nurse Practitioner Journal, right? At which one you got published in. I was published in the blue one once, also with a feasibility study. It's sad that some of those journals have gone by the wayside. I love that I can find things online, but I used to carry mine with me, pull it out in practice, tack articles to the wall. So
absolutely.
Yep. It was a good journal in finding information. So you had this wealth of knowledge as a registered nurse in billing and coding because you had to establish that for your patients. I love that it carried over to the benefit of all of us. But when did you start your own NP healthcare owned business?
So taking what my knowledge was about coding and billing, I actually partnered with a colleague of mine, and she was interested in the interviewing and resume writing and more of that type of, how you get your first job, what you need to know piece. So we felt synergy. So we created NP Business Consultants, and we worked together for a number of years doing conferences and education programs. And it got to the point where people were not so much interested in the writing resumes and that they were more interested in the coding and billing. So we amicably tough word, decided to split. And so now I do that as part of my education program. So I teach, I do coding audits, I provide healthcare facilities with consulting on anything coding and billing. And the nice thing is that I bring a unique perspective because I'm the clinician in the room. And oftentimes when I do a consult with a healthcare organization, the coders and billers will be in there, and then they'll hear me do my spiel, and the providers will go, oh, yeah. And they would hear, take me to the side afterwards and say, we've been trying to get them to do that, but they weren't listening to us. And having you here as a peer, made all the difference. So that's the benefit that I would bring to the table in the consults that I did as NP business consultants, which I still do. But I also started the National Nurse Practitioner Entrepreneur Network. And that's an interesting story because there's 4 founders. Sandy Berkowitz is a nurse attorney, and she's in the Philadelphia area. Her expertise has been in the insurance world. And she recognized early on that NPs were going to be the providers of the future, but we needed to give them, some push and education and encouragement. And so she put a call out and said, any NP out there in the Philly area want to start a practice, I will get you the money to upfront cost to get it off the ground. Guess how many takers she had?
How many?
0.
Oh my gosh.
So it got her to think, why would nobody want to do this if somebody actually gave you the money? What's holding them back? And in the meantime, she was talking at a synagogue with her colleague, Beth Chalik Kaplan, who was in CMS, and they were chatting. And then they were speaking with Lorraine Bach, who was I think at the time she was president of PCNP, the Pennsylvania Nurse Practitioner Coalition. And they all, got together and decided that, we need to do something. And I met Beth through the AANP health policy because Jean Moody would come every year and talk about Incident 2 billing. And I would always go up to her afterwards and say, when are we going to get rid of this? This is just, it's fraught with fraud. It doesn't recognize the providers that are really doing the service and the work. And Beth got my ear in this conversation. And she said, what do you know about Incident 2 billing? And I started to tell her what I did. And she said, oh, you would be perfect to add into our group. So I was kind of the outlier that was brought into the Pennsylvania group. But we all realized that we brought different skill sets, and we figured out we needed to do something to help NPs. So we partnered with Northeastern University at the time, Rebecca Love, and the dean at the time was Hanrahan, and I can't remember her first name, but they were putting on this nurse practitioner innovation and entrepreneurship conference. So we signed on with them to partner to do that. And we thought, if we have a handful of NPs, great. We had 100 NPs attend, and we're like, wow, I think we're onto something here. So we knew that we, as an organization, we were onto something. And we took in our first member in 2018. So
fantastic. Oh, I love that story so much. So tell us a little bit about what NNPen is, how people find it, and what you're doing now.
So NNPen, the National Nurse Practitioner Entrepreneur Network, we are a member service organization. So we do have an annual membership fee, and it's very reasonable. It's $180 for the year. It will be going up in September a little bit, but we're adding services all the time. We started out with our office hours as our flagship offering, which we still do today. It's the third Tuesday of every month, and we highlight a hot topic. It could be on we've done one on cybersecurity. We've done one on telemedicine, selecting an electronic health record. We just did one on different types of insurances, and that was very eye-opening, because a lot of people don't realize that if you're going into aesthetics or if you're doing 100% telehealth, your malpractice is going to be a little bit different than the general nurse practitioner primary care practice owner. So it's kind of interesting to hear that detail, but also business insurance, liability insurance, and all of that. All of these are recorded, and as a member, you get a free CE for attending them. So it's a wealth of information that we have that's available for members. But we also have support services for barriers to practice, like collaborating physicians, credentialing, billing, revenue cycle. We have an electronic health record now. We have partnerships with Centers for Medical Weight Loss, HCCI, which does home-based centered care. We also partner with My Advice, that does advertising and marketing. We also have IT support. We have the biggest thing is we have health insurance benefits. So we have vision, dental, but you could get long-term care. You could do it a la carte, whatever you need, with big major insurers. And that's something that it's available for the NP, the NP's family, or their employees. So that's something that we have that a lot of other organizations don't have. And the other thing is we do a conference every year that we try to provide information that's relevant to NP practice and encourage people to participate. And what makes us unique is that we actually allow opportunities for a lot of networking, because we realize that a lot of people do this in isolation, and they really need to have the chance to speak with other clinicians and practitioners that own businesses. So that's been very popular.
I love that you have networking. I'm taking notes. When is the conference annually? What month do you guys usually?
So we're preparing now for our March conference. It's going to be March 28th and 29th in Albuquerque, New Mexico.
Oh, beautiful.
We're excited. So we're in the planning phases right now. We actually put out a notice to our members, encourage them to give us some topics of interest, and we're going to build our curriculum. But there's going to be a lot of good content that's coming up. There's a lot to talk about. So I'm excited to get that rolling and to start to build that event, because I think it's going to be spectacular. And we're definitely putting in time for the networking, because we know how extremely important that is.
Yeah, that's what draws people together, right? For in person is really meeting other people that are like-minded. Tell me a little bit about your clinical practice that you run on the side and how that works, because I think it's incredibly innovative, and there are so many NPs out there who have a skill set that people need, and they don't think about taking it to other people.
Yeah, I think COVID really opened people's eyes to possibilities, especially when everything went telehealth and virtual, that, going to a hospital or an office or a building isn't the only place to deliver care. So a lot of NPs are starting to broaden their ideas of opportunities out there by seeing needs in their communities and wanting to develop that. My area of expertise is hepatitis C. I've been a GI practitioner since 2005 and took care of all the different types of treatment options. And now it's just so easy to give somebody the treatment that can actually cure them of their hepatitis C, so they can focus on all the other things that they need to get their lives together. What I found was that there was a need in addiction and rehab centers, sober homes, methadone clinics, MAT clinics, that they would have a clinician go in maybe 2 hours a month to see folks, but there really wasn't a way to effectively make change. You can't do anything when you're only seeing somebody 2 hours a month. So I got together with a nurse manager in one of the addiction and rehab centers, and it took us a year to get the program developed, present it, and pitch it to the management, and then to actually develop the process to implement it and get all the key parts in. And I think the buy-in from management was the hardest part, because they couldn't figure out, like, how could this nurse practitioner come in and actually see these people? Don't we have to employ her? Which is, a unique concept. But all things aside, it took us a year, and we launched in February this year. So I started with my first set of patients. But basically what we did is every new admission would be screened for hepatitis C. If they were positive, they were asked if they wanted to receive treatment while they were at the facility. If they said yes, then they had a standing set of lab orders that I gave them ahead of time. And then once all that data was done, they would refer them to me. And so I would review all the information, make sure that they were a candidate. And then we would schedule, I would go there one day and see all these patients back to back to back, do harm reduction strategies, talk about, other things that could help them, explain about the treatments, talk about, successes and trying to, get their life together, and do a lot of that one-on-one education. The medications were ordered that evening. The specialty pharmacy would send them, and the next morning they would start their treatment. So the loop was really very, very quick to get these folks on treatment. And I wish I had a camera, and I wish I took his picture, but I had one gentleman, the first day I met him, he had been 20 years homeless and in and out of rehab centers. And he said to me, he goes, "I never thought I would ever get my hep C treated." And I said, "Well, I'm glad that I'm here today and we can get you, started on your journey." So 4 weeks later, I went to see the next group of patients, and I had them put those folks back on the schedule so that I could follow up with them. And I didn't even recognize him. He looked so different. His skin was better. His outlook was better. His mood was better. He couldn't thank me enough, because he said, "I would never have gotten treated if you hadn't come to here." And to me, that is why I do what I do.
A powerful story. We were talking earlier about being healers, and it's things like that. This is why we get into nursing in the first place.
Well, it's that relationship with the patient that matters. When you're looking at the medical model, they're focused on the illness, where the nursing model focuses on the patient and their experience with that illness, and developing that relationship and developing that treatment plan that's tailored to them. And to me, I mean, that speaks to what we are lacking in healthcare today.
Mm-hmm. I love that you just said that. We have been doing some recordings, and I got to record with a nursing faculty, and it's like the universe is trying to tell me something. She brought up the difference between the medical model and the nursing model repeatedly, and how stark that is, and why nursing education and the nursing model is critical to patient outcomes and success. And we have data to support that. You said it took a year to get everything in place to get this rolling. I think that speaks volumes to the patients. What is the most difficult part, probably, of being an NP entrepreneur, and what kind of advice would you give people who are even thinking about this?
Well, I think the biggest thing is, do you have a need in your community, and do you have a problem that you can solve? That's the first thing, because if you're competing in a market that's already saturated, your chances of wins are going to be low. So survey your market, see what the needs are, develop the expertise, and get that education and training in that area that you want to pursue. And we don't get business training at all, not even when we're baby nurses, but more so even when we're NPs, because the expectation is, hey, now we're, nurse practitioners, we can go out and start these practices. And it's a lot more than just putting your name out on the door and starting to see people. There's a lot that goes into the preparation. And right now, to start a business, I mean, 60 to 120 days just to get credentialed with insurers. So factor that in with everything else that you need to do to start your business, it can be a daunting task. So I think not knowing what you don't know is the hard part for a lot of NP entrepreneurs, is like, and where do you go to find the information? So one thing that we've done to help that pain point is we started our Business Basics Accelerator course through NNPen, and it's a 12-week asynchronous course where you have about 3 to 4 hours a week of content that you get done amongst your busy schedule, because we know NP entrepreneurs are busy. And then every Sunday evening, we get on a Zoom call with all the cohorts from across the country, and we get a chance to talk about the topics, get an update on where people are at, and really to support each other, hold each other accountable. If somebody doesn't show up for a class, they're calling to say, hey, where were you? You know, we missed you. So it really provides that community that a lot of NPs that previously started businesses in isolation now can have, which is great. And also we know that there's a lot of information out there, and how do you pick the thoroughbreds in your stable? Well, we've done that. So we have credentialers that understand NPs and the nursing model, billing, all the components that we have in. People that are teaching our course they're marketing experts, they're credentialers, they're attorneys, they're CPAs. So we've collected all those folks to develop this course. We're going into our 9th cohort, which I'm excited. And we're actually, yeah. So we also recognize that there's people that are contemplating starting a practice and they really are not sure whether it's for them. So we have a little program that they can take just to kind of get their feet wet to see if this is really for them. And then they could go into the Business Basics course if they choose. And then we're working on an advanced course right now for that 2 to 3 year NP entrepreneur who's ready to grow their business and they don't quite know how to do that. So, or they have roadblocks or little hiccups that are preventing them from moving forward. So we want to be able to take that entrepreneur throughout that whole journey. And so our education is mirroring that.
I appreciate that. I love that you started out with knowing your market and your area, and they need to have a problem you can answer. So this is not just about wanting to own your own business or get into aesthetics or whatever. You've got to come in with an idea of where you're headed and what problem you're answering for the community.
Well, and you just mentioned something too that got me to think. I want to remind folks too that when you're looking at healthcare, and again, there's a lot of people out there that will help nurse practitioners start these cash pay type of practices, but we have to keep in mind too that Medicare and Medicaid, that population of folks need us, and they're not getting access to care right now or quality care. And there are many opportunities that NPs could work together to help manage that patient population. And yes, we know the reimbursements are not that great, but there's add-on services that you can do that can actually boost your revenue stream. And then there's codes that you can provide some additional services that can add revenue too. So there's ways to make it work, but I think we can't abandon the Medicare Medicaid population, because if we keep those people healthy, I mean, that's really going to matter in the healthcare scheme of things.
It will, and we do a really great job at that. The evidence points to that we can lower things like A1Cs and maintain that, or blood pressure, and do a really great job because we're good teachers. I love that you brought up our Medicaid and Medicare populations. Access to care is one of my core practitioner values, and I've always sought out a practice where that was the focus, people who did not have access to healthcare. But in that, I'm doing telehealth currently and carrying a whole bunch of licenses. So that's a different ball of wax. You and I should talk about that.
Yeah.
But
yeah, and I think that's a challenge too. It's like, how do you develop your business, especially if you want to be telehealth, and what you need to know to do that, because you can't be just licensed in Connecticut and do telehealth in Florida. If I'm not and that patient's in Florida, I have to be licensed in Florida.
Right.
People don't understand that there's these nuances. So that can be problematic as well. The other interesting thing, and I think this should encourage NPs to consider a practice, and an easy one is home-based care. And I'll give you an example of why I think we can be really effective in that space. The first thing is, when an elderly person is at home and they call their primary care provider and they have a complaint, a problem, what's typically the answer they hear? Oh, well, we can see you in 3 to 4 weeks. And the poor person on the phone is probably now to tears because they're anxious and they can't get in to see the provider. So what's the next thing they'll say? I can't wait that long. I have to be seen right away. So what's the response back to the patient at that point?
You should go
Go
to
to
the ER.
go to the ER urgent care.
Right.
And as an elderly patient, where do we not want them to go? Because if they go to urgent care or the ER, they're going to get a prescription for something they probably don't need, tests that they probably don't need, and a little Band-Aid placed on, whatever their issue was, and off they go, provided they could even get to the ER at all or the urgent care. So NPs are creating practices where they could go to the home, or the primary care could call that NP and say, can you check on my patient? We can go to the home, we can assess that patient. Do they have food in the fridge? What meds are they taking? Are there fall risks in the house? Do that holistic assessment, and then really provide really good care and probably keep them out of the hospital or urgent care. And that saves costs to care.
I love that you did a plug for home care. I think we're headed back to that sort of model, the house call model, particularly for those populations. So much of that underserved population has transportation issues. And they'll just tell you, or they can't miss work. They work 2 jobs and 12 to 14 hours a day, and they can't take off for anything. So meeting those needs within a community, I think, is huge. I love that you brought that up. All right, so we're going to answer a question. We're going to think about the implications of that. That made me think of another question. You deal with nurse entrepreneurs, NP entrepreneurs all across the U.S. In a bigger picture, is there any NP in any area, in any specialty, in any state that shouldn't be thinking about NP entrepreneurship? Can those things be overcome?
That's a great question. And all of our NP entrepreneurs come from across the country, and the type of practices that they're creating are totally unique. And again, it meets those needs in the communities, which I think are fantastic. So there's a lot getting into the addiction space, definitely. There's a lot that are doing home care visits. Like I was just saying, telemedicine is also big. We had a primary care for a mega church, a nurse practitioner in Arizona. Somebody did house calls for kids on an emergent basis. Rather than having them go to an ER or an office as a sick child, they're seen in the home, which makes so much more sense. Also, somebody was going into the daycares to provide mental health visits to the kids and having access to whoever was their provider, whether it was maybe it was a grandmother or a guardian or the parents, and to able to provide some of that connection in the mental health space. And then niche practices, so a lot of NPs still need to have their day job. And so oftentimes what will happen is they'll start these small niche practices on the side and build that up and then transfer into a more of a bigger practice opportunity. And we've tried to take care of a lot of the barriers, financial. We work a lot with community banks, business education, all those things that are the components that might be fearful, but fear is a good motivator. It really is. And when you escape from the confines of organized medicine, venture capitalist run healthcare, productivity based practice that messes with our nurse practitioner brains because we can't think that way. And when you get to create the practices that you want to do, it really opens up doors. So there's a lot of opportunity for NPs. And the other thing is, the more we can work together, the more we can raise each other up, because if you know that you're a primary care NP and you're looking for a psych NP colleague and you could find them in your community, you could partner together and you have referrals, you can sustain each other's businesses. Maybe you want to go in together and rent office space. There's a lot of opportunities for that connectivity to be expanded within the communities that we serve as well.
I love that you brought up all of that. So many ideas. It's fantastic.
I know, your head just explode.
I know.
These are endless.
Well, and these are the things that you're right. We don't teach in school. The curriculum is already so packed, but then we just send people out the door without. Some of these students even struggle to know what an NPI is and how to get one when they're exiting school.
Well, and I think the other thing that we don't teach them is that we're a profession, and with that, your voice matters in the profession. So, policy and advocacy, and I know people will say, I don't want to get into that. I just dislike politics or policy. It's real more policy than politics. But most of our practices are dictated by what happens in our states. And if we're not part of the discussion or know what's going on, there are forces that are going to try to pull back on our practice authority or put other restrictions on it. So our voice becomes truly meaningful in those opportunities. So I always tell people you should join your state organization for your day-to-day practice, your national organization for your federal, and then a specialty organization for those services that you want to provide that are specialty focused. So we have to be involved in healthcare in that way as well to motivate change. It's interesting because President Biden's administration actually funneled a lot more money to nursing in this last budget, which was huge because so much of general medical education to fund the physicians, I mean, they get billions of dollars every year and we get a pittance of that. And so much of the lack of primary care physicians really fostered that switch to send some of those dollars to nurse practitioners and to the nurse practitioner training program so that we can get more NPs out there.
Yep, that's exactly what brought up that medical model discussion yesterday was funding and federal funding for NP education or preceptorship, et cetera, so that we have access to care and impacting patient outcomes. And I think we have documentation of both, right? And the nursing model has huge impact. Before I get into and start wrapping this up, because you're going to speak for us soon, do you think being involved where you're involved and watching this journey over time that we are making an impact and change and that more change will come for nurse practitioners in practice?
Absolutely. And I think the more that we're out there wanting to create these practices to help patients in our communities, the more the communities are going to see what we're doing, the more we can impact with our local legislators, the more we can impact at the state level because the word's getting out that these MPs are actually making a difference in our communities, the more we can affect change at the state level where we could decrease the barriers to practice authority, increase funding to develop some programs that will support NPs or nurses throughout the journey. To the federal, where we can reduce some of the barriers with CMS, because guess what? 85% isn't helpful. Physicians are complaining they can't take care of patients at 100% reimbursement. Well, we're at a disadvantage because we get 85%. So that somehow has to change at some fashion. And one of the ways that it's impacting in the federal level is with these ACO creations through the Centers for Medicare and Medicaid Innovation, where NPs could be part of these ACO models. The REACH ACO is one of the ones that talks about health equity. And a lot of those programs reimburse at 100%, and all those barriers that we see on the federal level are gone. So we're at even with our physician colleagues when it comes to providing care for these patients. But and you've mentioned this earlier, is that nursing is that holistic approach, and all value-based care, because that freaks people out too. I don't know anything about value-based care. You practice it every single day, ladies and gentlemen. As a nurse, it's holistic healthcare, and that's the value-based model, and we will excel exponentially in it. But we have to understand it. We have to be more knowledgeable about it. We have to get skin in the game, and we have to know our value, whether we're in an organization or we have our own practice.
I love that you said that. And we can't just throw up our hands in frustration with the system. The only way the system changes is if we continually be involved, are knowledgeable, and give feedback to parties that matter.
And just note, like NPACE has had some seats at the table where some of the key decisions are starting to be looked at. I've attended the CPT RUC with ANA, and that was very exciting to know that we have nurse practitioners that are representing us in those spaces. That's phenomenal. Also, knowing that we're part of some of these ACO REACH models, those nurse practitioners are actually making some inroads, and our value is being calculated in those models. If we understand within our organizations the care that we're providing and how we can show our value by knowing the codes that we need to bill to get those increased revenues and to boost our bottom line, those are things that can actually help overall. And just knowing that whatever we do for our patients has value, and we have to be able to articulate that in some fashion. And then one other thing that we were able to do too is we were able to participate in a primary care transformation conference. We were one of two nurse-led sessions. One was done by a nurse talking about changes in healthcare from the bedside perspective. And then Lorraine Bach and I and Jen Perloff, we spoke about value-based payment models and how we need to get these barriers down so that we can participate and deliver this care and have our outcomes measured. And then I actually got invited to present at a coding workshop coming up, a coding conference. So I'm doing documentation from the clinician viewpoint, where I'm actually going to educate the coders about the differences between the nursing and medical model and how our practices are different, because it bothers me when I constantly hear, it's all about the physician and we're the other healthcare providers. But no, it should be physician and nursing. We're separate disciplines, but somehow we are all married together for some reason. But that's going to take a little bit to change, but the tide is shifting and the momentum's there, and people are starting to listen to us. People are getting care from NPs and seeing what the difference is. So I do think, we need to get more nurses involved at every level, nurse practitioners especially, to be involved in some of these changes. And we have to work together. The division has to go away. We have to actually come together at consensus to make effective change. And so practice owners, what we're trying to do is get practice owners to unite and have a space where we could actually, with our numbers, be able to advocate change with the healthcare insurers and other policy decisions. So it's taking time, but the momentum's starting for sure.
I love that. There is strength in numbers there.
Absolutely.
Definitely. Yep. We could just keep talking about this, but let's get into the coding and CPT. So I'm not going to get into what people need to know now. We are having a virtual conference in September, which means anyone across the U.S. can come. They don't have to buy a plane ticket. They don't have to take off work. They don't have to find someone to watch the kids or the dog or the houseplant. And they can hear you talk. Talk to us a little bit about what you're going to talk about in September.
So I'm excited. I was asked to do a keynote, and the topic is going to be NPs are a hot commodity and the possibilities to expand the nursing model. And I think we touched a little bit upon some of the ways that NPs can think about practice ownership, but it goes beyond that. How you get value in your organizations, and how even if you're an employed NP, that you have value and you have to be able to articulate that. But also that there's a lot of folks out there who think they know what nurse practitioners need and the nursing model of care, but they don't. And we're too trusting as NPs, so we have to be able to figure it out, like, who are the good guys and who are the ones that are not so, what's the term I'm trying to find? Not so worthy of us partnering with them. So you have to understand how to ask those questions and ferret out what's available, because people out there know we're a hot commodity. And we don't have a lot of money to waste on opportunities that are not going to pan out for us. So we have to be able to understand how we can work to get their questions answered so that we're making really good choices. And the other thing is that healthcare is not going to survive without us. So the medical model is dying. It's on life support right now. And unless we start to get our practices up and running and start taking care of these populations, the nursing model will die too. And we don't want that to happen.
I completely agree. And I think it goes across all advanced practice provider spectrums, whether that's nurse anesthetists or midwives or our PA brothers and sisters, that we're providing a big chunk of the care. In fact, a majority of primary care is advanced practice providers. We have got to start working together on this to help resuscitate
Yes.
the healthcare system.
Absolutely.
I love that. And you're also going to do a session on billing and coding updates.
Yes.
There's been a few.
Yes, coding updates and pearls, what you may not be aware of. And I'm really focusing a lot more now about protecting your NPI number. There's a lot of things going on out there in healthcare that, you may not be aware that could be potential risk for you. And it could mean, aspects of your license. It could affect your ability to be a Medicare, Medicaid provider. You could get fines, you could get jail time. So these are all things that I'm going to talk about a little bit, but I'm also going to talk about ways that you can utilize the coding so that it's more reflective of what we're doing with our patients, so that we can articulate our patient care and the services we're providing to our patients. And that, to me, like the social determinants of health are huge right now.
Yes.
And I know in what is happening is people are measuring it across the board, but what are they doing about it? And that's where we come in, because we're the doers of taking care of some of these social determinants of health. So if we know how to code those correctly, Medicare is going to see, hey, these nurse practitioners are taking care of these really sick patients. They're providing this type of care. And how do we know this? Well, there's codes that can help us. And I'm going to share a lot of that new information. And there's new codes out there too that can capture the care in between our patient visits that we don't know we can capture that as well. So there's going to be a lot to unpack.
Yay! I love that we're going to talk about that, because I think that's on the horizon. You know how we looked at value-based care and patient outcomes. Social determinants of health are going to be the next impact statement, and reimbursement will be tied not only to assessment, but affecting patient outcomes based on who has what. Yeah.
And the thing is, we're the whole package. If you look at, and I'll just throw out this quick example, there's a lot of like direct to consumer marketing for mental health services. And you might hear of one, you'll get linked with a person, and then they're going to do an assessment, and then they're going to send you to the psychiatrist who will prescribe your medication. When you go to see a psychiatric NP, for example, it's one-stop shopping. You get the assessment, you get the medication if that's appropriate, and you get the therapy. So it's all in one, where there might be a lag time between when that initial person sees you and you get to see the psychiatrist, for example, and then, who follows you afterwards. So we're a very cost-effective, very tight model. So we talk about fragmentation of care now. That's one problem we could solve if we just, get out there and have the courage to start our businesses.
I love that. I get so excited talking to you about all of this. This is so great. So how can people find you besides coming to our September virtual at NPACE if they want to know more?
Sure. Certainly, www.nnpen.org is a website. Feel free to peruse all the offerings that we do have. If you want to reach me directly, you can email me at Lynn, Lynn, @nnpen.org.
Perfect. Thank you so much. Thank you, Dr. Rapsilber, for taking time and just starting to scratch the surface of the impact that nurse practitioners can have on healthcare. I can't wait to talk about this more in the future. And then we're going to talk about 2025 soon and see where we can expand this with you. Yeah, I'm excited too. Thank you for sharing your time. I know it's incredibly precious. For all of our listeners today, thank you for being here. Lynn does have some education that she's already done with us. It's at learn.npace.org, but you can find out about the September conference at npace.org and all things NPACE. And thank you so much for tuning in. You can find our podcasts on Apple, Spotify, YouTube, all the places you find podcasts, and we'll see you at the next episode.
Thank you so much.